Question 61. Which of the following terms refers to soft tissue injury caused by blunt force? A. Contusion. B. Strain. C. Sprain. D. Dislocation. Answer A. Explanation. A contusion is a soft tissue injury caused by blunt force. It is an injury that does not break the skin, is caused by a blow, and is characterized by swelling, discoloration, and pain. The immediate application of cold might limit the development of a contusion. A strain is a muscle pain from overuse, overstretching, or excessive stress. A sprain is caused by a wrenching or twisting motion. A dislocation is a condition in which the articular surfaces of the bones forming a joint are no longer in anatomic contact. Physiological adaptation. Question 62. Which of the following indicates a hazard for a client on oxygen therapy? A. No smoking sign is on the door. B. The client is wearing a synthetic gown. C. Electrical equipment is grounded. D. Matches are removed. Answer B. Explanation. A synthetic gown might generate sparks of static electricity, which can be a fire hazard, particularly in the presence of oxygen. The client on oxygen therapy should wear a cotton gown. The remaining options are appropriate safety measures, reduction of risk potential. Question 63. Erythropoietin is used to treat anemia in clients with renal failure. Should be given in conjunction with A. Iron, folic acid, and B12. B. An increase of protein in the diet. C. Vitamins A and C. D. An increase of calcium in the diet. Answer A. Explanation. The kidneys of a client in renal failure produce no erythropoietin, a hormone necessary for RBC production. Erythropoietin can be given as replacement, but the client needs adequate iron, folate, and B12 to increase the effectiveness of EPO. Choice 2 is not necessary for RBC production and can increase uremia. Choice 3 and 4 are not necessary for RBC production. Physiological adaptation. Question 64. When obtaining a health history of a menopausal woman, which information should a nurse recognize as a contraindication for hormone replacement therapy? A. Family history of stroke. B. Ovaries removed before age 45. C. Frequent hot flashes and/or night sweats. D. Unexplained vaginal bleeding. Answer D. Explanation. Unexplained vaginal bleeding is a contraindication for hormone replacement therapy. Family history of stroke is not a contraindication for hormone replacement therapy. If the woman herself had a history of stroke or other blood clotting events, hormone therapy could be contraindicated. Frequent hot flashes and/or night sweats can be relieved by hormone replacement therapy. Health promotion and maintenance. Question 65. A pregnant Asian client who is experiencing morning sickness wants to take ginger to relieve the nausea. Which of the following responses by the nurse is appropriate? A. I will call your physician to see if we can spot some ginger. B. We don't use home remedies in this clinic. C. Herbs are not as effective as regular medicines. D. Just eat some dry crackers instead. Answer A. Explanation. This statement reveals cultural sensitivity. Ginger is sometimes used to relieve nausea. The other statements are culturally insensitive and do not show an awareness of herbal pharmacology. Physiological adaptation. Question 66. Which of the following physical findings indicates that an 1112-month-old child is at risk for developmental dysplasia of the hip? A. Refusal to walk. B. Not pulling to a standing position. C. Negative Chamberlain-Book sign. D. Negative Ortolani sign. Answer B. Explanation. The nurse might be concerned about developmental dysplasia of a hip if an 1112-month-old child doesn't pull a standing position. An infant who does not walk by 15 months of age should be evaluated. Children should start walking between 1100 and 15 months of age. Chamberlain-Book sign is related to weakness of the gluteus medius muscle, not hip dysplasia. Ortolani sign is used to identify congenital subluxation or dislocation of the hip in infants, health promotion and maintenance. Question 67. A client with which of the following conditions is at risk for developing a high ammonia level? A. Renal failure. B. Psoriasis. C. Lupus. D. Cirrhosis. Answer D. Explanation. A client with cirrhosis is at risk for developing a high ammonia level, reduction of risk potential. Question 68. What is the primary nutritional deficiency of concern for a strict vegetarian? A. Vitamin C. B. Vitamin B12. C. Vitamin E. D. Magnesium. Answer B. Explanation. Vitamin B12 is the primary nutritional deficiency of concern for a strict vegetarian, health promotion and maintenance. Question 69. Which of the following foods should be avoided by clients who are prone to develop heartburn as a result of gastroesophageal reflux disease, GERD? A. Lettuce. B. Eggs. C. Chocolate. D. Butterscotch. Answer C. Explanation. Ingestion of chocolate can reduce lower esophageal sphincter (LES) pressure, leading to reflux and clinical symptoms of GERD. The other foods do not affect LES pressure. Basic care and comfort. Question 70. A client has been taking alprazolam Xanax for 4 years to manage anxiety. The client reports taking 0.5 milligrams 4 times a day. Which statement indicates that the client understands the nurse's teaching about discontinuing the medication? A. I can drink alcohol now that I am decreasing my Xanax. B. I should not take another Xanax pill. Here is what is left of my last prescription. C. I should take 3 pills per day next week, then 2 pills for 1 week, then 1 pill for 1 week. D. I can expect to be sleepy for several days after stopping the medicine. Answer C. Explanation. Xanax, like other benzodiazepines, can cause withdrawal symptoms that include agitation, insomnia, hypertension, seizures, and abdominal pain. The drug must be slowly decreased to prevent withdrawal symptoms. Psychosocial integrity. Question 71. A client is taking hydrocodone Vicodin for chronic back pain. The client has required an increase in the dose and asks whether this means he is addicted to Vicodin. The nurse should base her reply on the knowledge that A. The client's body has developed tolerance, requiring more drug to produce the same effect. B. The client is preoccupied with getting the drug and is experiencing loss of control, indicating drug dependence. C. Addiction is the term used to describe physical dependence with withdrawal symptoms and tolerance. D. The client has a dual diagnosis of substance abuse and chronic back pain. Answer A. Explanation. Drug tolerance is characterized by the ability to ingest a larger dose without adverse effect and decrease sensitivity to the substance. Substance dependence is a severe condition indicating physical problems and disruption of the person's social, family, and work life. The psychological behaviors related to substance use are termed addiction. Dual diagnosis is the coexistence of substance abuse and psychiatric disorders, psychosocial integrity. Question 72. A safety measure to implement when transferring a client with hemoparalysis from a bed to a wheelchair is A. Standing the client and walking him or her to the wheelchair. B. Moving the wheelchair close to client's bed and standing and pivoting the client on his unaffected extremity to the wheelchair. C. Moving the wheelchair close to client's bed and standing and pivoting the client on his affected extremity to the wheelchair. D. Having the client stand and push his body to the wheelchair. Answer B. Explanation. Moving the wheelchair close to client's bed and having him stand and pivot on his unaffected extremity to the wheelchair is safer because it provides support with the unaffected limb, basic care and comfort. Question 73. A client with dumping syndrome should ... while a client with GERD should ... A. Sit up 1 hour after meals. Lie flat 30 minutes after meals. B. Lie down 1 hour after eating. Sit up at least 30 minutes after eating. C. Sit up after meals. Sit up after meals. D. Lie down after meals. Lie down after meals. Answer B. Explanation. Clients with dumping syndrome should lie down after eating to decrease dumping syndrome. GERD clients should sit up to prevent backflow of acid into the esophagus. Basic care and comfort. Question 74. Which of the following organs of the digestive system has a primary function of absorption? A. Stomach. B. Pancreas. C. Small intestine. D. Gallbladder. Answer C. Explanation. The small intestine has a primary function of absorption. The remaining digestive organs have other primary functions, physiological adaptation. Question 75. Which of the following neurological disorders is characterized by writhing, twisting movements of the face and limbs? A. Epilepsy. B. Parkinson's. C. Muscular sclerosis. D. Huntington's chorea. Answer D. Explanation. Huntington's chorea is characterized by writhing, twisting movements of the face and arms. The remaining options are neurological disorders that do not have much such movements as part of their disease process, reduction of risk potential. Question 76. The nurse is teaching parents of a newborn about feeding their infant. Which of the following instructions should the nurse include? A. Use the defrost setting on microwave even stir warm bottles. B. When refrigerating formula, don't feed the baby partially used bottles after 24 hours. C. When using formula concentrate, mix 2 parts water and 1 part concentrate. D. If a portion of 1 bottle is left for the next feeding, go ahead and add new formula to fill it. Answer A. Explanation. Parents must be careful when warming bottles in a microwave oven because the milk can become superheated. When a microwave oven is used, the defrost setting should be chosen and the temperature of the formula should be checked before giving it to the baby. Refrigerated, partially used bottles should be discarded after 4 hours because the baby might have introduced some pathogens into the formula. Returning the bottle to the refrigerator does not destroy pathogens. Formula concentrate and water are usually mixed in a 1:1 ratio of 1 part concentrate and 1 part water. Infants should be offered fresh formula at each feeding. Partially used bottles should not have fresh formula added to them. Pathogens can grow in partially used bottles of formula and be transferred to the new formula. Health promotion and maintenance. Question 77. A client who is immobilized secondary to traction is complaining of constipation. Which of the following medication should the nurse expect to be ordered? A. Advil. B. Anisette. C. Sclinosil. D. Colis. Answer D. Explanation. Colis is a stool softener that acts by pulling more water into the bowel lumen, making the stool soft and easier to evacuate. Basic care and comfort. Question 78. The nurse explains to a client who underwent gastric resection that which of the following meals is most likely to cause rapid emptying of stomach? A. A high-protein meal. B. A high-fat meal. C. A large meal regardless of nutrient content. D. A high-carbohydrate meal. Answer D. Explanation. Meals that are high in carbohydrates promote rapid gastric emptying. The other options are associated with decreased emptying time, basic care and comfort. Question 79. A betterer is usually someone who A. Grew up in a loving, secure home. B. Was an only child. C. Was physically or psychologically abused. D. Admits he has a problem with anger. Answer C. Explanation. Many betterers report having been abused as children. Psychosocial integrity. Question 80. A 20-year-old obese female client is preparing to have gastric bypass surgery for weight loss. She says to the nurse, I need this surgery because nothing else I have done has helped me to lose weight. Which response by the nurse is most appropriate? A. If you eat less, you can save some money. B. Exercise is a healthier way to lose weight. C. You should try the Atkins diet first. D. I respect your decision to choose surgery. Answer D. Explanation. This statement is most appropriate as it shows respect and empathy. The other statements are both insensitive and unprofessional. Physiological adaptation. Question 81. In teaching clients with box traction, the major areas of importance should be A. Nutrition, ROM exercises. B. ROM exercises, transportation. C. Nutrition, elimination, comfort, safety. D. Elimination, safety, isotonic exercises. Answer C. Explanation. Nutrition, elimination, comfort, and safety are the major areas of importance. The diet should be high in protein with adequate fluids, basic care and comfort. Question 82. Light therapy can be effective for A. Overcoming weight problems. B. Helping with allergies. C. Use in alternative medical treatments. D. Working with sleep patterns. Answer D. Explanation. Light therapy can be effective in treating problems associated with sleep patterns, stress, moods, jaundice in newborns, and seasonal affective disorders, non-pharmacological therapies. Question 83. Assessment of the client with an arteriovenous fistula for hemodialysis should include A. Inspection for visible pulsation. B. Palpation of trill. C. Percussion for dullness. D. Auscultation of blood pressure. Answer B. Explanation. Trail should be present. The client should be taught to check this daily at home. Pulsation is not typically visible. Percussion gives no information about the patency of a fistula. Blood pressure is not auscultated in alarm with an AVF. Auscultation of the AVF for brute is part of an assessment for patency, physiological adaptation. Question 84. James returns home from school angry and upset because his teacher gave him a low grade on an assignment. After returning home from school, he kicks the dog. This coping mechanism is known as A. Denial, B. Suppression, C. Displacement, D. Fantasy. Answer C. Explanation. Displacement is the transference of anger to another. Anger is displaced on the dog as a convenient object. Psychosocial integrity. Question 85. Which condition is associated with inadequate intake of vitamin C? A. Rickets, B. marasmus, C. kwashiorkor, D. scurvy. Answer D. Explanation. Scurvy is associated with inadequate intake of vitamin C. The remaining choices refer to other nutritional deficiencies, health promotion, and maintenance. Question 86. Which is the proper hand position for performing chest percussion? A. Cup the hands, B. Use the sign of the hands, C. Flatten the hands, D. Spread the fingers of both hands. Answer A. Explanation. The hands are cupped for performing percussion, producing a vibration that helps loosen respiratory secretions. The other hand positions do not accomplish this task. Reduction of risk potential. Question 87. Which of the following is likely to increase the risk of sexually transmitted disease? A. Alcohol use, B. Certain types of sexual practices, C. Oral contraception use, D. All of the above. Answer D. Explanation. STDs affect certain groups in greater numbers. Factors associated with risks including being younger than 25 years of age, being a member of a minority group, residing in an urban setting, being impoverished, and using crack cocaine. Physiological adaptation. Question 88. Why might breast implants interfere with mammography? A. They might cause additional discomfort. B. They are contraindications to mammography. C. They are likely to be dislodged. D. They might prevent detection of masses. Answer D. Explanation. Breast implants can prevent detection of masses. Choices 1, 2, and 3 are not ways in which breast implants interfere with mammography. Reduction of risk potential. Question 89. A healthcare worker is concerned about a new mother being overwhelmed by caring for her infant. The healthcare worker should A. Immediately contact Child Protective Services. B. Provide the mother with literature about child care. C. Consult a therapist to help the mother work out her fears. D. Refer the mother to parenting classes. Answer D. Explanation. Preventing of child abuse is centered on teaching the parents how to care for their child and cope with the demands of infant care. Parenting classes can help build self-confidence, self-esteem, and coping skills. Parents benefit by understanding the developmental needs of their children while learning how to manage their home environment more effectively. The classes also increase the parents' social contacts and teach about community resources. Psychosocial integrity. Question 9C. Which is the proper hand position for performing chest vibration? A. Cut the hands. B. Use the side of the hands. C. Flatten the hands. D. Spread the fingers of both hands. Answer C. Explanation. The hands are flattened over the area of the body where chest percussion is used to conduct vibration through the chest and loosen secretions. The other hand positions do not accomplish the task. Reduction of risk potential. Thank you for watching.